Hold on.
Yo, the lies. Oh, that you never make it. Hopeless, so it seems. Eyes closed, hands open wide to embrace your dreams. Sometimes you gotta take a loss just to get the win. Like lots of sin was popping in like oxygen when boxes win. Focus on the mental, never lose like a smooth instrumental. Better choose on the move in a pinto. Choose what I get to, never lose move on the move, but it's simple. Never give up and we winning it, maybe. We just keep winning, we conquering daily. Envision and pay me, it's never the sway me. Indigenous, maybe we winning, it's crazy. Your opportunity, your opportunity, your opportunity, it's your opportunity, your opportunity, your opportunity, your opportunity, it's your opportunity, your opportunity, your opportunity, your opportunity, it's your opportunity, your opportunity, your opportunity, your opportunity. Moving it up like a man in a major. The focus is heavy and deadly and steady and seeming it's ready. They heavily ready to take control. Life is cold, sky's the limit, but we walking on them stars. Pressure be burning, we chasing the feeling and stacking the ceiling and making a million and feeling appealing. We killing and drilling, but never gon' stop it. We chasing the sun. Life is cold, sky's the limit, but we walking. Yo, the lies so that you never make it. Hopeless, so it seems. Eyes closed, hands open wide to embrace your dreams. Sometimes you gotta take a loss just to get the win. Like lots of sin was popping in like oxygen when boxes win. Focus on the mental, never lose like a smooth instrumental. Better choose on the move in a pinto. Choose what I get to, never lose move on the move, but it's simple. Never give up and we winning it, maybe. We just keep winning, we conquering daily. Envision and pay me, it's never the sway me. Indigenous, maybe we winning, it's crazy. Your opportunity, your opportunity, your opportunity, it's your opportunity, your opportunity, your opportunity, your opportunity, it's your opportunity, your opportunity, your opportunity, your opportunity, it's your opportunity, your opportunity, your opportunity, your opportunity. Moving it up like a man in a major. The focus is heavy and deadly and steady and seeming it's ready. They heavily ready to take control. Life is cold, sky's the limit, but we walking on them stars. Pressure be running, we chasing the feeling and stacking and selling and making a million and feeling and killing. We killing and drilling, but never gon' stop it. We chasing the sun. Life is cold, sky's the limit, but we walking on them stars. Your opportunity, your opportunity.
Hey,
Hey,
excited to see you.
you too, girl.
How are you?
I'm doing wonderful, honey. I just got done getting luscious for this video, baby.
Well, you look amazing.
Thank you
So let's go
much.
ahead and kick it off because we've got a lot to get to tonight. So, and we may have Dublin running around in the background, just to warn you. So, all right, everybody. My name is Debbie Jennings. I've been a nurse for about 25 years, and we started this company to really get the word out to everybody about how to advocate for your own healthcare. So I'm going to kick it over to my partner in crime, Devonna St. James Whitney.
Hey, everybody. My name is Devonna St. James Whitney. I've been doing female impersonation for about 16 years, and I also was a past foster youth child myself. And I survived it, honey. So today we're going to be talking about health advocacy and how to advocate for yourself. So Debbie, kind of tell me the challenges with that, with advocating for your medication or finding a healthcare provider. Kind of give me a brief description of like how to go about that.
Yeah, so I love that you asked that. And the reason why we started this company is as a nurse for the past 25 years, I have seen people struggle in the healthcare setting from getting appointments, from understanding how their medications are taken. And health literacy is a problem. And what health literacy means, because people are like, wait, there you go, using a word I don't know. Health literacy is literally understanding your own healthcare. And so when you don't understand your own healthcare, it impacts the way you take care of not only yourself, but the way you take care of a family member, a child. It really impacts the way that people read their prescription label, their medication. And, we'll have people that will read a medication label and it says take twice a day. Well, they don't know that they have to take one in the morning and at night. They'll maybe take two at the same time. And so all of this kind of compounds and it's around really poor health. And it is estimated that about 9 out of 10 adults suffer from poor health literacy. So when we talk about what the compound effect is, it's also about when you don't understand how to take care of yourself, you're going to go to the emergency room more often than you would at urgent care. Or maybe you're going to go to the emergency room and that is going to be your primary care provider, right? And so we want to make sure that we break these down and we help people understand there are different steps that you can do to help it better and then or make it better for you. And I just want to tell you something really quick that is so profound to me is that 1 in 3 adults, they struggle with unpaid medical bills. And this is really a compounded impact of not understanding your poor health. And this actually hits the United States into the billions of dollars. In fact, one of the latest statistics that I saw is between 106 to 236 billion dollars impact to the United States on unpaid medical bills, poor health literacy. It just goes on and on and on.
So kind of tell me like let's say, so recently I went to the hospital, I want to say about 2 years ago, and I had surgery. So there were some things that I didn't know that happened after the surgery. So kind of explain to me like what happens after I have the surgery, during the surgery, who needs the money? Who's gonna call me for a check? Who do I pay? Do they take health insurance?
So that's a really good question. So that's where a lot of people struggle is around the health insurance and they don't understand and they don't read the fine print. And one thing about the videos that you and I are going to be doing is that we're going to be able to break down a lot of these topics and we're going to put them in all these other areas. And I'm excited about that. And when people have their health insurance, it's really important that you understand. Now, I'm going to throw a couple terms at you. This is called in-network and out-of-network. All right.
Okay.
In-network basically means that your health insurance is going to pay for that hospital. So when you think about one example that we give in one of the videos is a Costco versus Sam's. So if I go to Costco, I can't use my Sam's card, right? Like I want to make sure that everything I get in Costco is maybe like an in-network. So it's going to be lower cost and that is going to be predominantly for that one care. Now, and this is really under an HMO plan. And again, that kind of gets everyone confused because it's an HMO. Is it a PPO? What all does that look like? It is absolutely vital that people understand their health insurance coverage and that they know what it looks like, what it covers, and also what your deductible is. So your deductible is a really important number when you're looking at, is it going to be $1,000 deductible? This is the amount that you're going to have to pay out throughout the year. And so when you go to the hospital, those costs will go toward your deductible. So, and when you leave the hospital, and I want to tell everybody this because oftentimes when people walk into the hospital, they're like, oh my gosh, it's big, it's scary. Everyone is going to tell me what to do. And what I have found working in the hospital that's been so frustrating, and we have done this because when people walk in those doors, all of a sudden they just relinquish all care, right? And they're not advocates in their own healthcare and they're not asking questions. When you are discharged from the hospital, make sure that you understand which medications you're going home with, that you understand exactly your discharge instructions. If you speak a different language, you absolutely have the right to make sure that not only are you given the discharge instructions in your language that you choose to speak, but also your hospital should provide you with some sort of telecommunication in there. And it's usually like a phone, and they'll have a communicator that will be there, a translator that will go through all the different languages. And there should be no reason. And even if you sign, there should be somebody available to help you through that. What I will tell you is if you are in the hospital and you're having a really bad experience and things are not going the way that they need to go, you want to make sure that there's always a patient advocate in the hospital that you can talk to. And the patient advocate is great. And if you feel like you're not getting really good headway with your nurse or something like that, which I hope you are as a nurse, I think they're all going to be amazing. But if you feel someone is not hearing you, pick up the phone in the room of your hospital and just dial 0 and say, I want to speak to the patient advocate, because you want to make sure that they're there for you. Ask questions. One really important thing on your insurance is that there are a lot of ways that you want to make sure you look at the bills that are being sent to you, and you want to look for and challenge the hospital. I would like an itemized bill. So like when you go to a restaurant, they'll give you like $30, but then if you get an itemized, it says you got a burger, you got a fries, you got a milkshake. Maybe that's what I like to eat. And so that's an itemized bill. What they do is they tell you everything that you ordered, and you always want to look at that, right? Because you're not just going to pay the bill. You want to look and make sure that they're charging you exactly for what you did. And we have, more often than not, we'll have people that are like, they'll push back on the bill. And absolutely, if you get a bill that you do not agree with, push back on that bill. Absolutely.
So I was going to ask you, speaking of like reporting and like maybe I'm having some concerns about something that happened in the hospital or navigating my health. What's this HIPAA thing? I keep hearing HIPAA. Like, what is that?
Yeah, HIPAA is really important. And when you look at HIPAA, it's HIPAA. And this is actually something that was passed, and I believe it's in the 1990s. And really important, this is a privacy act. So the people when you're in the hospital or when you go to your provider's office. So when I say provider, what I mean is a provider can be a nurse practitioner, it can be a physician, it can be anyone who's kind of dictating your health care plan. That's your provider. So when you go see your provider, only people who you have said are okay to look at the chart can look at the chart. So say that Devonna is a nurse and working somewhere else in the hospital. She is not going to be able to go look in the chart of my care. That is only for me and the people who are taking care of me. Really important. And it's also important for people to understand that you can ask for your medical records. This is something that you see. If you are not already connected, and this is usually through your provider's office, a hospital, there's an app called Care Everywhere is one of the plans, but it's really how you can get information on your x-rays, your medications, everything that's being done for you when you go to your provider's office. Oftentimes there is communication that is set up. You want to make sure if you have a phone where you can't download an app on it, make sure that you can check it online, because this way you are monitoring everything that's going on. You're seeing those results, and you want to make sure that you're watching for what we call duplication of services. And this is kind of a big word, sorry to say that, but you want to make sure that, so Devonna, say that you went in and you're like, oh my gosh, my throat hurts really bad. And the provider went and they did what we call a big workup, right? They're going to go in, they're going to test you and all this stuff. Doesn't get better, doesn't get better, doesn't get better. And then you may go to another provider a week later and they're going to do everything the same. So you want to really speak up and say, listen, I've already had this lab work done. These are the results, and you'll be able to pull them up in your phone if you're already tapped into some sort of patient portal. If you do not have access to that when you leave, and this is really important, ask for copies of your radiology reports, ask for copies of your lab reports. This is your medical record and you have every right to it.
Good. Well, going back to like talking about providers and doctors, the other day I went to go see a provider and it seemed which I would hope he's going to be my main doctor, which I also want to talk to you about that, how to find like a main care professional. but it seemed like it was very short, as if he only had a lot of time to see me individually. And I wanted to ask you, is that a thing? Can I not meet with my doctor for a long extended amount of time? And how do I find a better provider if I'm not feeling him or
So
her?
really, yeah, I know, right? So really good question about this. And so let's start with how to find a provider. So
Yes.
to find a provider, one thing that you can do is really good word of mouth, right? Maybe you know somebody who recommends this person, this person. Another thing you can do is you also want to make sure that they take your insurance. So when you sign up for your health insurance, whatever plan you have, if you have a Medicaid plan, if you have under the Affordable Care Act, whatever, if you have a workplace plan, whatever insurance you have, you can actually go in and you can, there should be, usually most will have a find a provider tab on your health insurance. So say it's Blue Cross Blue Shield. So you get in there, you hit the find a provider, you can put in, you look, pick which one you want. Are you looking for an eye doctor? Are you looking for ear doctor? Are you just looking for a primary care provider? When you see primary care provider, and this is where it gets really confusing because you start going through all these things, you're like, I don't know. And you may make it yourself an appointment for OBGYN when you really don't need one, right? So
Yes.
primary care provider is so important. So that is basically the person who's going to direct your care. This is who you're going to go see to check your blood pressure, your heart rate. They are basically kind of the conductor of your health. And it's so important that you have someone that listens to you. When you go to the office for somebody in healthcare, whatever provider that you pick, it's you can go for a visit for them and you want to interview them, right? Almost like it's not like you're just going to sit there. Your first visit is going to be sort of like an interview. But I will tell you, the reason why the visits are fast is there's high demand for primary care providers. There's high
Okay.
demand, but also insurance companies will only pay for a shorter visit. As much as they would love to give you an hour worth of their time, there's no way that they're going to be able to fit all their patients in. So it's actually really responsible for you as the patient to show up ready to go. And you want to be able to say, listen, show up with a list of your medications, current medications. Very important. If you don't have them written down somewhere, we have people that bring a bag of their medications all the time, and that's perfectly normal. That's okay. So you want to make sure that you bring in medication that you have. You want a list of aches and pains. If you've had a past surgery, especially if this is a new provider, you want to help them out and give them a little bit more history of what's going on with you. I always suggest if you keep a notebook that's just for your healthcare needs, and this is something that you can do. And if you're doing it as a family, a lot of times there are, people my age that are having to take care of little ones and also their parents. So if you want to keep a notebook that has, this is my mom's needs, my dad's needs, or whatever that is, or whatever family member or person that you're taking care of, you want to make sure that you keep that. Always keep an updated list of the medications. That's incredibly important. Because if they are going to give you a new medication, they need to know that it's not going to interact with any medications that you have.
Yes.
Something will tell me, in fact, I was talking to a good friend of mine about, when patients come into the office, kind of like, what are some things? And she said, honestly, when you walk into the office, they may say, oh, I have a headache, but maybe their blood pressure is really high. Well, you may be really unhappy because they're not looking at your headache for some reason, but because maybe they need to focus on your blood pressure because that actually can cause a headache, right? So there
Hmm.
may be things that are going on that are in the with you that you're maybe not too happy about, that you're like, why aren't you looking at this? But there may be something bigger that they're picking up on. You want to make sure that
Hmm.
they ask your questions. Always take in, I have family members that show up all the time in the hospital setting and they'll have a pen and paper. They'll have a little notebook and they'll have all their questions written down. You want to make sure that this is written down for you. Another thing is when you leave the office, again, just like when you leave the hospital, you want to get a copy of the medications. You want to get a discharge plan. You want everything lined up. If I cannot part anything else on you, I want to make sure that people advocate. This is why we are doing this, Devonna. We are doing this. And that's why I'm so excited you're partnering with me on this, because we have to get people to understand that it's okay to speak up. There's
Yes.
nothing worse in the world than for somebody to say, yes, doctor, I think that's what I'm going to do because you said so. And you never push back. You never did your research. You never made sure that this was the best option for you. And I'm talking about everything from like your child to later as an adult to the birthing process. You want to make sure, we have a really good conversation on one of our videos with a doula, and we talk about developing a birth plan. You want to make sure that you are looking at outcomes for your provider. So there's a website that you can go to, which is Leapfrog, and they will actually give you some really good data. You want to make sure are the outcomes that you're not going in there and you're just saying like, oh, they have a high C-section rate. That's probably not somebody that you want to go to. You want to make sure that you're doing homework as well. And if you feel that you're not vibing with that person, then you have every single right to request a new provider in that group or to go find another provider. I want everyone to feel like they can control the wheel of their own health.
Yes, and they should be controlling the world because it's their bodies and what
Yes.
they're putting into it. And speaking about putting into it, so the other day, Debbie, I got prescribed some medication and I went to the good old Walgreens or Walmart to go get my
Mm-hmm.
medicine. And they told me about generic medication. And a good sister always trying to save $1. So is there a difference between on brand and off brand? And is there any different side effects that come with that?
So love this question. So I typically, if you are looking for Tylenol, let's just take Tylenol, for example. Everybody knows Tylenol. So if you go for what's called brand, so Tylenol is the brand, acetaminophen is the generic. So
Mm.
acetaminophen is the exact same thing. So Amazon actually has a good brand of acetaminophen that you can buy. So you're always going to find brand versus generic in most medications that you see. One thing, though, that is really important when you start looking at this is that you want to push back, because if you go pick up your medication from a pharmacist and ask them, is there a generic that we can get for this medication? Sometimes when a medication is really new to market, there may not be a generic option for it, but you should always try to find one. And then there's also coupons that you can get. So GoodRx, have you heard of that one?
I've never heard of that, but honey, I'm gonna write that down. I love the coupons.
Yeah, so there's GoodRx is a great one to look at. Waiting on Dublin. This is what happens when you go live. I can't edit my child out over there.
Devlin thinks he's
So
famous, honey. He wants to be one of the
I know
queens.
Dublin wants to be in every video and it makes Bones really mad. So good thing. But we can edit him out. But one thing about GoodRx is really good because you can pull down some coupons off of that, but also the manufacturer, all of them will give out coupons. So if you are on a high cost medication, go to the manufacturer, ask your pharmacist if there is a coupon for that medication. Now, there are some really good ways that you can kind of navigate what are those coupons looking like. And you can actually do a pretty simple Google search on the medication that you're prescribed and it will tell you. Another thing I'll tell you is that I always like to tell this around medications is that if, for example, you find a pill on the floor, or if maybe you're helping a loved one out with some medication, you're like, I don't really know what you're taking. I always tell everybody, you have to know everything that you're putting in your body because you need to know the side effects. And you need to know when a provider is giving you a new medication and you're feeling really dizzy, or maybe you're feeling really nauseous, there are going to naturally be some side effects with medications that you want to take, right? There are going to be side effects around nausea is usually a pretty common one that we'll have. And so maybe you need to take it with some food, right? Maybe you need to take it a different time of day when it's not going to cause that effect for you. But there are some medications, if it is making you not function, you need to let your provider know. Sometimes this will happen with, you'll go in and you'll be put on a diabetic medication or a blood pressure medication, right? And they're controlling the blood pressure that they're treating in that moment. So, but if you go home and you start working out and you're doing all sorts of stuff and you're doing everything right to try to drive down that blood pressure, what is going to happen is you're still on that high dose of medication, and that can actually start making you have a lower blood pressure than normal. So you want to make sure if you're on blood pressure medication, one thing you can do is buy a blood pressure cuff to really kind of help control it. A lot of times, you can find different ones that you can get through your insurance company. They have all sorts of discounts that they'll offer on that. But I want to go back to if you found a medication on the floor, because I know you're kind of like, whoa, but
I
this
know,
will
it's like,
happen all the
whoa.
time. I'm not saying you're going to take the medication on the floor, but say it
I
roll
hope
on
you
the
don't.
table, right?
Yes.
Yeah. It's not the 3-second rule, right? But if it's expensive, you may do it. I'm just saying. So what you want to do, every single pill has what's called an NDC number on it. So N is in Nancy, D is in David, C is in cat. And this number is specific for that pill. So say you are helping a loved one with their medication. They're like, oh my gosh, I have all these pills. And you're like, what is happening? Should you even take all these together? You can actually look for the number on the medication and you can type NDC and that number straight into Google, or you can go to drugs.com, GoodRx. These are really good places for you to look for. Another website that I love to talk about is actually poison.org. This is a really great website to go to if for some reason you feel like somebody had an overdose on medication or somebody swallowed something that they shouldn't have in the house. Maybe they drank some bleach or something happened, a kid got into something. You can actually go to poison.org and you can even simulate something happening to somebody so you can kind of see how it works. And it's absolutely phenomenal, the information that you can get on that website. So
And what was that
one of my
website
absolute
again?
favorite websites.
What was the website again?
Poison.org. It's actually done by the Poison Control, I guess, of America or whatever, but it's really, really good. So
Love that, because emergencies happen all the time. And if you don't know what to do or what's happening, you don't know how to approach it. So that's a
yes.
very good resource. So Debbie, I've came to you before with this question, and it's a very large question, but is there any resources out there that helps navigate you through finding affordable health insurance?
Such a good question. Okay, here's the thing. If you are on a workplace plan, so if your employer, so say I work full-time at UT Health. And so if you are working there full time, I'm going to be under what's called a workplace plan. And what you do is you start looking at options. You always want to look at options and you want to see when you are picking out health insurance. And I know this is something that we looked at for you. And anytime I help people pick out health insurance, I always say, don't just go for the cheapest plan, because you may get a really cheap plan and you're going to be paying more out of pocket down the road. You want to make sure if you are a very healthy person, you rarely go to the doctor, you may actually want to be what's called on a high deductible health plan. And we're actually going to do a video about that later on, because that is an absolutely phenomenal plan and for people to get. And you can get what's called a flex savings account. And this is a card. It's like a credit card that will come that you pay into, and this will actually help with some of those hospital bills. But pick a plan, sit with somebody. There are absolute organizations that are out there that will help you pick out a plan. You can always drop a comment for us in the chat here. We'd be more than happy to reach out to you, help you look for a plan. Do not go for the cheapest plan that you see, okay? Unless you are literally like, I never see a doctor because I'm a body of perfection. You want to make sure that you are picking the plan that is right for you. If you know that you're going to have multiple visits throughout the year, you're on medication, you may have to pay something higher out of pocket, because that's just going to be how it is. But it will absolutely pay off in the end with all the doctor's visits, because usually what will happen is they'll want to scan something or, do all sorts of things, but know what is covered. Know if you are a woman and you need a mammogram, is that covered? You want to make sure, are your OBGYN visits covered? If you have a child who is going to have to get vaccines, different well visits, you want to make sure, because a majority of that stuff will be covered, but you want to make sure that you're on a plan that is actively going to cover the needs of you and your family when you're picking that out.
And see, today we went over a lot of topics, and I just wanted to ask, can you maybe put in your information so if someone had a question, they can contact you with a question? Because there's so many different brackets, so many different things that happen. but this is your body, like what I'm
Yes.
putting in my body. And it's so important to know these intricate details with navigating healthcare, period.
Mhm.
Because if
Yes.
you miss this information, then you might make the wrong decision that you possibly didn't want to make. And so
Mhm.
that's why health literacy is so, so important. So please, girl, tell us where we can hit you up, send your questions, maybe do some, get a drink or something, girl. Tell us where we can hit you up.
So one thing that you can do is probably one of the easiest ways to get a hold of me is through social media. And that is doing well. Yeah. And what I'll do is I will have this once this video is uploaded, and it will be there for you. You can always drop DM for me. And so did you like that? DM? Did I say it
DM,
correct?
hey, Deb is getting
Devon,
hip with the
I
kids.
know Devon is teaching me how to be really good with all this stuff.
The
So
lingo.
the lingo, yes. So that's really important. And we will definitely connect you with resources.
Love that. Love that. Was there anything else you can think of that maybe I possibly didn't ask?
I guess I just want to make sure that we are out there getting in front of people to let them know that you are the driver of your health. And I know that we say that over and over, but I cannot tell you, Devana, how sad it has been for me over the years to see people say, okay, well, that's just what the doctor said to do. And they never push back and they actually ended up in a worse situation.
That's
And when health literacy is so like something that Bones and I and you are very passionate about, because when you've been on the wrong side of something and when you've been in a provider's office and you're scared, it is very, very scary. I've been in the healthcare field for a very, very long time, but a couple years ago, I had a pretty big scare with something, and it was scary. And it's almost like all the things that you need to ask, but that kind of is blank when it goes out the window. So before you go into a provider's office, before you go to the hospital, make sure you write down everything. If you know that you're a type of person, and people will tell you this all the time, like if you have a child that gets sick or a parent, you're all of a sudden like, oh my gosh, I can't remember anything, right? And so you want to make sure that you have somebody there who is calm, who is going to be able to ask those questions, and that you're okay with them hearing the information. And I will tell you that if you are not okay with the person next to you hearing the information, it is your right to ask them to step out. It is your right to ask them. Now, if it is a parent with a child situation, that is something totally different. But when you are out there advocating for yourself, you're 18 and over, you can ask for that parent to step out of the room so that you can hear the information. And a good provider will usually say, is this something that we can discuss in front of your parent or with the person with you? Or they will say, why don't you go ahead and step out so we can talk about a couple of things? And that's really good because you want to make sure that there's that privacy. Sometimes I think as parents, we want to go, oh, we want to hear everything that's happening. But we also want to make sure that we give the autonomy to have a really private conversation with a provider. Because if you are not upfront, like, so maybe you have an itch that's been there for a long time or a rash, that is something that you need to make sure that you bring up really quickly into the visit. Write down things that you want to talk about so that you don't forget. Because how many times has a provider left the office? I mean, this has happened to me, and you're like, oh my gosh, I totally forgot to tell them that I haven't slept for a week. You know what I mean? So you want to make sure that you have all of these things written down. And so, yeah, so we're extremely passionate. Please don't, forget to subscribe us. This is actually going to get uploaded, and we're going to come at you with a lot more topics. We're super excited about, we're going to do some stuff with our friend Sarah talking about mental health and anxiety and all the different medications and all the fun stuff. So there's just a lot out there. I want to say one thing before we go, and I'm really passionate about this right now. If you are in a mental health crisis, if you are feeling depressed, there's a really powerful resource for you, and that is through 988. This is a national number, just like 911, and you can actually text 988. And you can text them if you're having a mental health emergency or if you're just not feeling good. You can even text them. So you can do it as a trial right now and just say, listen, I'm showing somebody how this works, or I had a really rough day. I'm having a rough time at work. Do you have some strategies that I can use? You want to make sure that you can use that. I just want that, because you just never know like who's in a mental health crisis, and you never know where people are. So always feel that you have resources to reach out to. 988 is absolutely beautiful. So
That's amazing. I didn't even know about 988. I knew
yes,
about 211, but I didn't
that's
know about
211 as
988.
well.
Yes, 988 sounds like a great tool. And is that fairly new, or has that been around?
It's probably within the last couple of years, but we're really trying to push it out.
Perfect, perfect.
Mhm.
Well, awesome, Miss Debbie, doing well. I'm so happy that I could be here. I hope we get to do more videos together so I can interview and I can feel like this is 2020. But I definitely think that it's important to know how to navigate the health system and how to get what's best for you. Because if you don't stand up for yourself, honey, who's going to do it for you? So make sure you
Absolutely.
know this information. So going into the doctor's office, you know what's going on, because once again, knowledge is power.
Knowledge is power. Yes. I love you. I love you. I love you. Bones loves you. Mwah. Mwah.
Yes. Can't wait for the
Dublin
next
loves you
video,
too.
honey. Okay, Devin, I know Devin loves me. He loves my snacks. I can't wait to see him. I miss him like crazy.
Oh, well, he's over there somewhere stalking you, I'm sure.
Probably.
All right. Everyone have a wonderful evening. Don't forget to like, subscribe, and please drop us a comment. Let us know what other lives you want. Watch a couple of our videos. We are here to help. Our goal is to improve health literacy and access to care. We want to make sure that you get to where you need to go from a health care standpoint. All right. Love you. Stay well, my
Love
friend.
you. Bye, y'all.
Bye.